Women with HIV can get pregnant and have healthy babies just like everybody else. Now, how to do this is very important for you to know. Before you start trying, meet a gynecologist. We will advise you certain blood tests to see how severe your infection is and how good your body's immunity is to fight the infection. And we might even start you on certain medications to keep your infection under good control. Now, once we see that you are in an ideal scenario, we advise you to start trying to get pregnant. Once you get pregnant, again, it is mandatory that you continue taking all of your HIV medications. It's very, very safe for you to take HIV medications during pregnancy. We will prescribe you the right ones. Now, during your pregnancy, people who have uncontrolled infection can be more prone to getting infections repeatedly, but taking your medicines regularly, good controlled infection, you will not get any additional infections throughout pregnancy. You won't be at any risk of infecting your unborn child in the belly if you keep your infection under good control through medications. Now, during delivery, vaginal delivery is something that is safe for everybody to have. Now, in HIV, there is a certain doubt again in this area to most pregnant women. But if you've kept your infection under good control, we have certain cutoffs below which we can allow normal vaginal deliveries. So if your infection is well controlled, you can have a normal delivery just like everybody else. But if your counts are seeming a little bit high, if your infection is not adequately controlled, then we might advise you to go for a cesarean to be on the safer side to prevent your baby from getting the HIV infection. Now, after delivery, the same rule applies even for breastfeeding. If your infection is well controlled, you can go ahead and breastfeed without any risk of infecting your child. But if your infection is not well controlled or not up to our limits, then you might need to go with formula feeding. So these are the important things that you need to know if you have HIV and if you're trying to get pregnant. Now, those who are trying, there is no reason why getting pregnant should be difficult because of HIV, unless there is any other infertility issue. If you are just HIV and if you and your partner are healthy, you should be able to conceive naturally. You won't need any treatments for that. So it's very important to know all of this, and HIV in women is not something that inhibits them from getting pregnant or having a baby.